For my level 2A fieldwork, I was at West Kendall Baptist Hospital. It's an acute rehab. And in the acute rehab, we experience patients with all kinds of complex and intense medical trauma, conditions, surgeries, illnesses. And so basically, the rehab team is like the first initiative towards recovery for these patients. We work closely in a multidisciplinary team to best treat the patients. In this hospital, the culture is very close knit. It is a smaller hospital. The rehab department has good rapport with all of the medical staff, and they truly respect the opinions of the therapist. The therapist and all of the rehab department work together as a team to have the best outcomes for the patients. We usually have the opportunity here to co-treat with physical therapy, which I found very helpful for both the therapist and the patients. It allows for more hands-on, more safety with the patient. And in acute care, patients can be hooked up to a lot of lines and tubes, which can become very challenging when moving the patient. But being able to make sure you're safe and situated before moving the patient is key for a safe transfer. In this hospital, we mainly receive our patients by doctor or nurse orders for an evaluation. During the evaluation, we determine if the patient is appropriate for therapy. We set up frequency and durations for therapy, and we also give recommendations as to where the patient should go, such as inpatient rehab, SNF, home health, outpatient, and the doctors take those into consideration as well as social work. Something that surprised me most about this setting is all the ways you can do interventions with like limited supplies. You really learn how to be creative. There's not always, we have a rehab gym, but when the patients aren't able to transfer and go to the rehab gym, you're very limited to just themselves and inside the room. Overall, it was a really good experience.